Do you know why you're here today?
A head-to-toe assessment.
Exactly. We're going to be doing a comprehensive, full assessment on you today.
Great.
Yeah, so you appear to be your stated age of 22. And it looks here that you're in nursing school.
I am.
How is that going?
It's great, but it's stressful. Definitely.
I can only imagine. Is there anything you do to relieve your stress?
I run and I go to coffee with my friends.
That's great. Yeah. It's important to have those things so you can help with the stress relief.
Yeah.
Great.
Definitely.
So before we start the assessment, do you have any questions at all?
No, I don't think so.
Okay, so I'm going to ask you to remember a couple of objects, and then I'm going to ask you again at the end of the assessment to recall those objects, okay?
Okay.
So the first one is this.
Stethoscope.
Exactly.
Pen light.
Great. And the third one is this.
Hand sanitizer.
Wonderful. Okay, so I'm going to go ahead and get started.
Okay.
So you appear to be a healthy female. Skin looks good. No discoloration. No visible rashes or lesions. Okay, I'm just going to take a look at your hands here. Your nail hygiene appears to be good. Cap refill of 1 second. Excellent. Okay, so I'm just going to go ahead and take a look at your hair. Is it okay if I touch your head?
Yes.
So I'm going to give you a quick massage here.
Perfect.
Looking for any cysts or alopecia. Okay, so it doesn't look like anything is present. Your hair is full, distributed evenly, shiny hair, looks really good.
Thanks.
Okay, so I'm just going to go ahead and take a look at your face now. You appear very symmetrical, which is great. I'm just going to go ahead and ask you to make a couple of faces.
Okay.
Can you smile for me, please? Very nice. And frown. Great. Okay. And can you just puff out your cheeks? Excellent. Good. So I'm going to put my hand right here by your face, and I'm just going to ask you to turn to my hand, but I'm going to resist, okay? So here. Very good. Very good. Okay. And see your ears. Looking good. They appear very symmetrical. What I'm going to do now is I'm going to take a tuning fork and I'm just going to strike it and place it on your head here, and I'm going to need you to tell me if you hear the sound equally in both ears, in one ear louder than the other.
Okay. Equal.
Equal. Great. Perfect. Okay, so now what I'm going to do is I'm going to take this tip here and I'm going to place it on your face, and I'm going to need you to tell me if you're experiencing sharp or dull sensations, okay? So this is sharp.
Okay.
And this is dull.
Okay.
So we're going to go ahead and get started, okay?
Okay. Dull. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Excellent. Okay. So I'm going to go ahead and palpate your lymph nodes, okay? So assess for any large lymph nodes. Great, that appears to be normal. Very good, and I'm just going to put my hands on your thyroid here and ask you to swallow, okay? Okay, go ahead and swallow for me. Excellent. So now what I'm going to do is go ahead and look at your eyes, okay?
Okay.
If you can just go ahead and look right in my pen light. Very good. Okay, and so your pupils are equal and reactive to light accommodation. And if I can just ask you to follow my pen light here, I'm just going to move it around, but don't move your head, just your eyes, okay? Okay, great. And if you can go ahead and stick out your tongue and say, ah, ah. Great. And look in your mouth. Good. Appears you have all your teeth.
Okay.
Good dental hygiene.
Yes.
Yes. And if I can have you stick your tongue out from side to side like this. Very good. Excellent. Okay. Okay, so I'm going to go ahead and assess your chest now and your lungs. So I can see from here you have good posture. The lateral diameter of your chest is greater than anterior posterior, so there's no barrel chest present. So what I'm going to do now is I'm going to listen to your lungs. Every time you feel me place the stethoscope, I'm just going to ask you to take a deep breath, okay? If at all during it you feel winded, please just let me know.
Okay.
Okay, go ahead and take a deep breath. Good. Excellent. Now I'm just going to go ahead and listen to the back.
Okay.
Deep breath. Okay, and one last time. Okay, great. So your lungs sound really good. No adventitious sounds like crackles or anything like that. So it sounds like you have nice, healthy lungs.
Cool.
Okay, so now what I'm going to do is assess your heart.
Okay.
So, okay. Okay, and if you can just displace your breast for me. Okay, excellent. And so now I'm just going to go ahead and listen again with the bell of the stethoscope.
Okay.
Thank you.
You're welcome.
Excellent. Your heart sounds nice and strong.
Oh, good.
Great. It's all that cardio you've been doing.
Yeah.
Excellent. So now I'm just going to palpate your carotid pulse here. Just do one side at a time. Okay. Okay, good. Appears to be equal on both sides. So now what I'm going to have you do is I'm going to have you lay down here so I can assess your abdomen. Paperwork. Great. So now, if you don't mind, I'm going to have you lift your short shirt up and pull the pants just down ever so slightly so I can assess your stomach. Alrighty. So the first thing that I'm going to do is just going to take a listen.
Okay.
Alrighty, excellent. Bowel sounds are heard in all four quadrants. Very good. So now I'm just going to percuss your stomach here, looking for any adventitious sounds. Excellent. And so next thing I'm going to do is light palpation. If you experience any pain during this, please let me know. Alrighty, and now I'm going to go ahead with more firm palpation. Once again, if you're in any pain, please let me know. Okay, so the next thing I'm going to do is palpate for your liver. So I'm going to ask you to take a deep breath, and then I'm going to go ahead and palpate you on your right side. You might feel a little bit of discomfort, but if it's painful at all, please let me know. Okay, ready? Take a deep breath. And exhale. Okay. Good. Doesn't appear to be inflamed at all, so that's great. So now what I'm going to do is assess your peripheral extremities. So the skin down here is looking good. Doesn't look like there's any edema present, no excoriations at all. Cap refill on your toes is 1 second. Very good. Now I'm going to assess your pulses. Alrighty, +2 bilaterally.
Great, that's good, right?
Yeah, that is exactly what we want.
Great.
Okay, excellent. And last one. Great. Excellent. Okay, so you can go ahead and stand up for me. I'm going to go ahead and ask you to sit in the stool.
Okay.
Okay, so can you go ahead and grasp my fingers? Oh, very strong there. Yeah, good. The grip strength is equal, and both hands. And I'm going to go ahead and assess your D10 reflexes.
Okay.
So we'll start with your arm. Go ahead and relax for me. Excellent.
I'm a little hypo-reflexive sometimes.
That's okay. Go ahead and relax. Very good. And now I'm going to ask you to let your feet dangle here. Very good. Very good. Okay, so now if you can please stand for me. I'm going to assess your gait. So if you can just go ahead and walk to the edge here. Good. Noting that her posture is good, her hips are equal, and under her legs. And go ahead and walk on your heels, please. Very good. And back. Excellent. And one last time on your tippy toes. Okay, excellent. You can go ahead and have a seat, Molly. And do you remember those 3 items that I had asked you about in the beginning of the assessment?
Stethoscope, hand sanitizer, and pen light.
Very good. Great. So you appear to be a very healthy female for 22. Do you have any questions for me before we end the assessment?
Nope, I think everything's covered.
Okay, great. You did really well.
Okay,
It looks to be
thank
good
you.
health. Thanks for coming in today, Molly.
Thanks for having me.
Great.